Good afternoon, everyone. My name is Jerome Bailey, and I'm with the ESRD National Coordinating Center. Thank you for joining us today for the ESRD NCC Patient Education Webinar event. For those of you joining us for the first time, welcome. For those of you not new to these COVID-19 calls, welcome back. As you know, this is a new time for our patient COVID-19 calls. The patient calls are also now 1 hour long and occur every other week. We made these changes based on the feedback we received from our patient subject matter experts, so thank you. The ESRD NCC webinar events are held in partnership with the Centers for Medicare and Medicaid Services. The calls feature patient and professional subject matter experts from around the country sharing how they or their organization are coping with situations related to COVID-19. Before we get started, I wanted to let you know this call is being recorded and will be posted to the NCC COVID webinar webpage, usually within 48 hours. So let's take a look at the agenda for today. Today we are happy to have Gary Moore, a peritoneal dialysis patient from Alaska, Lonnie Green, an in-center hemodialysis patient from Atlanta, but we are going to start with Lisa Hall, Patient Services Director for POMAGIN ESRD Network 16. Our topic, health and safety at work during the COVID-19 pandemic. So what's this call about? You will hear tips to empower yourself to cope with COVID-19. We will share some real-world experiences that you can put to use. We have some resources for you to use and share with others. And this series of calls is available to you offering a variety of topics. Let's learn more about our featured speaker, Lisa Hall. Lisa Hall has been the Patient Services Director for ESRD Network 16 since 2010. Prior to that, she served as Patient Services Director for ESRD Network 7. She has been published in peer-reviewed journals and textbooks and presents nationally on vocational rehabilitation, emergency preparedness, ethics, conflict resolution, social media, and psychosocial spiritual impacts of kidney disease. Lisa has served as a leader advisor for the CNSW Executive Committee and the CASER Coalition and the Journal of Nephrology Social Work. As our panelists go through their presentation and you have questions, please submit them using the chat feature through WebEx or the Q&A on the lower right of your screen. When we get to the question and answer section of this presentation, we will share the questions we have received with our speakers. Our goal is to answer as many questions as time allows. I will now turn the call over to Lisa Hall. Lisa, thank you for being with us today.
Thank you, Jerome and Matt, and I appreciate the invitation. We can go on to the next slide, please. So yeah, I'm going to be talking about vocational rehabilitation, which is something that I get very excited about and enjoy helping navigate for both patients and for staff members in the dialysis setting. But we're also going to frame it within the environment of COVID-19. Next slide. You can be on dialysis and work. I'm sure all of you know some real life examples of this. What better time than now when the whole country is on pause to take the time to focus on your goals. Do you want a job? Do you want a better job? Would a college course or a degree help? Would being on home dialysis help you to have more flexibility to achieve your goals? These are things to think about. And if you're planning for a kidney transplant, what are your dreams for life after transplant? What do you envision? Next slide. For those who are already working, you can keep your job when you need dialysis. I mean, everyone I think knows this, that disability only pays about a third of what you would be making if you were working in a job. Voc rehab is not just about getting back to work, though. If you're already working, they can also help with job accommodations and take care of any barriers that you might have in the workplace, job modifications, helping the job place to modify their policies to accommodate you, and even physical facilities. Next slide. So I was asked to talk about going to work during COVID-19 pandemic. We hear a lot and see a lot on the news about essential workers, but people are working in all types of settings, not just in grocery stores or in medical settings, and have to consider the risk at their workplaces. We all know the dialysis patients are at a higher risk of having serious complications from the pandemic. So before you go to work, some recommendations that have come out of the CDC are to take your temperature before work, wear a face mask at all times, continue to practice social distancing in the workplace as you do outside of work, wash your hands according to the guidance that's provided by the Centers for Disease Control, and you really want to pay attention to the surfaces in your work environment. You want to clean them with detergent, followed by household disinfectant. Things like tables, doorknobs, light switches, handles, phones, faucets, sinks, really anything that other people might be touching in addition to you. You don't want to share your phone headset at work with other people or other objects that other people have used near your face. And of course, in work and outside of work, we don't want to congregate with others in crowded places. Next slide. So I learned some new things in getting ready for this talk. I've seen a lot of information come across, as many of you have, regarding COVID-19, mostly from the Centers for Disease Control or CASER Coalition or Ready.gov. But OSHA also has some guidance for the general population that, of course, we want to adhere to if we are more vulnerable. For safety at work, and it's broken down by risk level, you want to ask your employer what your risk level is of these 4 levels, because each employer is supposed to assess what their occupational hazards are. And I'm going to provide some examples from the OSHA website. Next slide. So the lowest exposure risk is folks who have minimal contact with the public, such as someone working from home, office workers who don't have close contacts with others in the building, healthcare workers that might be providing telemedicine. Long-distance truck drivers actually are even listed in the lower exposure risk. So the next level on the next slide is the medium exposure risk. Next slide. The jobs that require frequent and close contact with others, not known or suspected, but just other people. If you have frequent contact with international travelers, contact with the general public, such as in a school, very high density population in the building, in your work environment, and then high volume retail settings, such as a grocery store or a department store. Next slide. There's another level actually higher than this, but the high exposure risk includes people who are doing healthcare delivery and support staff who must enter patients' rooms. I think all of us are trying to avoid going to the hospital unless absolutely necessary at this time. Of course, you want to follow your doctor's guidance if you need to be at the hospital and have something taken care of. Medical transport workers moving known or suspected COVID-19 patients. Mortuary workers involved in preparing bodies for burial or cremation. Folks who were people under investigation at the time of their death for COVID-19. And the final level is on the next slide, which is very high exposure risk. And this is what we hear a lot about on the news, our heroes out there helping on the front line with people who have COVID-19 or just people who are in intensive care in hospitals. Very high potential for exposure would include anyone performing aerosol generating procedures in a medical setting, healthcare lab staff handling specimens from people who are being investigated for the virus or who are positive, and then morgue workers performing autopsies on people known or suspected of having COVID-19. I know this is kind of morbid. When I was reviewing the slides, it seemed I don't really want to talk about this, but it is important to know what your level of risk in each setting is and have those conversations with your employer if you are working. Talk about something more pleasant that I'm excited about on the next slide, which is vocational rehabilitation. People often complain about having to work. I might have done it once or twice in my life, but the truth is the benefits of work far outweigh the burden of work. I've got some of those listed here. You get education and training and learn new things when you're working. Obviously, your income can be higher, better insurance and healthcare access, which especially is helpful if you're considering a transplant. Better independence, a sense of confidence, competence, self-esteem from accomplishing something that's challenging at work or learning new things. Your social circle is bigger. You have more people that you can share ideas with, share photos of your family with, maybe share goods and resources sometimes. A lot of borrowing and lending, I guess, happens when you meet new friends at work, even just sharing recipes. It gives you a much broader social circle than being at home and just going to dialysis and not having much community. People who work, studies have shown, I'm not going to go through each one of those, have shown that people are happier and healthier when they're working and have a better quality of life, a more normal lifestyle, and then a sense of purpose and identity. Voc Rehab is available to help you pursue your personal goals, and some of these are not financial or insurance or tangible goals, but they give you an overall sense of well-being. Next slide. So some steps you can take to achieve your goals. You want to ask for support from your dialysis staff, not just your social worker, but from your team. Is your schedule fitting with what your life goals are? Does your dialysis schedule interfere with your ability to pursue education or to have a job? Have you talked about home treatment options where you might have more flexibility and also more energy to work? And if there are any barriers in you pursuing vocational rehabilitation, your dialysis staff can help with solutions. Again, your social worker is key in that, but also your clinical staff. Next slide. So we're going to go through just a few barriers that have been commonly reported by people on dialysis. Obviously, I know you and a lot of your peers might feel that you have little energy at times, or you have too many other health conditions. Looking at other treatment options like home or nocturnal dialysis, which is gentler on your body, might help you to have the energy. Talking with your doctor about physical therapy can help with the barriers. Depression is very common in folks who are on dialysis, and your social worker can help offer support or refer out. A lot of people are afraid of losing benefits, Social Security benefits, Medicare. Well, it's important first off to understand if you have Medicare, because of end-stage renal disease, you will not lose that no matter how much money you're earning if you're working. But there are work incentives to help to secure your funds and keep you from losing your check if you decide to pursue vocational rehab or work. And there's also individual counseling to kind of help you understand what your personal situation would be if you were working. Because a lot of people share horror stories or myths that may or may not be true and may not fit your individual needs. So the next slide. Some of those Social Security work incentives include a trial work period. Basically, this is just letting you work for 9 months and earn as much as you want, and you're still getting your full Social Security check. If after the 9 months, you're making a pretty good income and you haven't had setbacks where you're not able to work, then your Social Security check, part or all of it, can be impacted from work. But you still can earn money and keep your check if you're earning less than $1,260 per month. But if you're earning more than that, your Social Security checks will stop. And if you're legally blind, then the amount is higher for that threshold. It's a little bit complicated and technical, and that's one reason people meet with voc rehab counselors or have more in-depth conversations with their dialysis social workers to understand this. But a lot of folks don't know that you could actually be on Social Security and work and supplement your Social Security as long as you want, as long as it stays under that threshold. And then there's also work-related expenses that you can deduct from that amount. So let's say you're getting $1,200 a month, but you're spending money on work-related transportation items, medical devices, assistive devices to help you adapt to the workplace. Some of those things are calculated. There's a whole long list of that, but those are just some examples. Next slide. Another thing that's commonly not known, and I've experienced with patients over the past nearly 20 years successfully, is they've followed their goals and their dreams and thought about their life after transplant, and they took advantage of work incentives in place to help them keep their Social Security benefits, which means the income received from SSDI or SSI for as long as 7 years and 3 months after transplant. And the way that's done is, well, normally your Social Security check ends a year after transplant, and Medicare ends 3 years after. But if you are involved with vocational rehab before transplant and continue to be involved, or if right after transplant within a year, you engage with voc rehab and work with a counselor on a plan for self-sustainment, there are work incentives that can extend that well beyond the normal time frame. And obviously there's manuals that give more information, and again, reaching out to your dialysis social worker for this information can be helpful. Next slide, please. So how do you get started? Just the nuts and bolts of it. You want to search for a voc rehab office on the Social Security's Choose Work navigator. Basically, you put in your zip code and you say whether you want a vocational rehabilitation office, which we all hear more about, or an employment network. And I'll talk about some of those in a moment, which is also considered a voc rehab type program. But they have a little bit of different services and usually easier access than the voc rehab office, which often has budget concerns and aren't able, sometimes wait lists. And then there's also virtual online services, and I'm going to focus on that today because it's becoming quite a virtual world for those of us who are staying at home and practicing social distancing, and so it's helpful to know about these things. If you don't have the internet, you can call Maximus. It's basically just the contractor who helps give information or answer questions about work and benefits, or how work would affect your benefits and where to get help. And then, of course, keeping your dialysis social worker informed on how things are going and if there are any barriers in the process. There are client advocacy agencies for each state that can help to address any barriers, like if your worker is giving you misinformation or telling you, oh, wait till you have your transplant to come and talk about work goals, you're too sick. I mean, those kinds of things happen all the time. And there are programs in each state to protect the clients, advocate for you to get better service from a voc rehab program. The next slide. So as I mentioned, we want to talk about virtual employment networks. One that I find really helpful is Career One Stop. It does some career training, job search results, helps you build a resume. It's very easy to navigate, and we get good feedback about that particular resource that you can kind of put what your job interests are, and you'll get emails in that related field when there's openings. AAA Take Charge actually pays work-related expenses to help you stay employed or move toward a career goal. That's something actually I learned about from one of my colleagues who knows more about this than I do a couple of years ago, and folks have reported to me that that has been a helpful program. My Employment Options is another virtual employment network that qualifies as the voc rehab, under the work incentives. And they specialize in work at home, such as customer service, sales, healthcare, clerical, and tech support. I refer a lot of people who live in rural states. I cover 5 rural states, including Idaho and Montana. 5 states, including Idaho, Montana, Alaska. Although there's actually rural areas in Washington and Oregon as well, where people might benefit better from working at home for a job that may not even be locally, physically, in that state, but they can employ you. And My Employment Options has a program that helps with that. I think I actually copied and pasted the wrong link there. But if you Google My Employment Options, you will find it. I'll also have my email address at the end of this presentation, and I can help with that. So the social distancing era is really a great time to connect with virtual programs that can assist with supporting your employment or education goals. Next slide. So if you meet with a counselor, what are they going to do? Voc Rehab or one of the employment networks will evaluate your strengths, resources, and priorities, concerns, abilities, career interests. Just talk with you, especially if you're looking at a transplant. What does life look like after transplant? What do you want to do? What's happening in your life that's not that would be better if you actually were able to work and earn some money. They'll help you get education or training to get a job, and I'll give you a couple brief examples of that in a moment. Any special equipment you need, and help you keep a job after you get one. We're living in unusual times that require unusual measures, and we all hope for a vaccine and more effective treatment for COVID-19 will come and allow us to return to life as we know it. In the meantime, I think it's a good time to focus on, am I where I want to be in terms of my quality of life and my activities, and consider some of these things that I've shared with you. I'm going to very briefly, on the next 3 slides, share some success stories from patient advisors on our Network 16 Patient Advisory Council, and then hand it over to Gary and Lonnie. Next slide. So Nancy is, she was a nurse. She retired as a nurse just a few years ago. She started dialysis in 1966 before Medicare paid for dialysis. So when she became an adult, she had to get a job with insurance to be able to be on dialysis and until Medicare started paying for it. A voc rehab counselor helped her to get her degree in education. And then later, she actually went through voc rehab again to become a nurse. And Nancy worked as a rehab nurse in a hospital for 40 years before retiring. Next slide. So some of you might know Michael. He serves on some of the national committees that the NCC hosts. Michael had to quit his work as a restaurant manager when he started dialysis. He had a social worker who wisely kind of recognized some strengths in him and pointed out that he would really make a great social worker. He got help from voc rehab to get his bachelor's in social work and his master's in social work. And because he started this process prior to his kidney pancreas transplant, he was able to continue to receive his SSDI income and Medicare until he completed 6 years of education. That was actually 6 years post-transplant. Now he doesn't need it. He's a licensed clinical social worker and he works full-time in a dialysis setting. And my final brief description of a success story from someone on our patient advisory committee, you're going to meet him in a moment, is Gary. And Gary went to college to remain in the workforce, and he'll be sharing his own story. But I just want you to know that he's really inspired me over the years with his focused efforts to continue to provide for his very large family. And I think he's received quite a bit of help from vocational rehabilitation to help him to do that. So next up is, are we going to do questions before Gary and Lonnie? Yeah, from Lisa.
So Lisa, we are going to hold off on the questions for now. We're going to hear from Gary and Lonnie, but I want to say thank you. And I want you to stand by as well as we move on in the call. So, now we'd like to get the patient's perspective on working during the COVID-19 pandemic. We have two great speakers with us. Lisa has already mentioned one. Gary Moore is a husband, father, avid music lover, and professional rope splicer, yes, from Anchorage, Alaska. He's also a peritoneal dialysis patient. Gary is active in the kidney community, volunteering with the ESRD Network 16 Patient Advisory Committee, the ESRD NCC National Patient and Family Engagement Learning and Action Network, and the Kidney Community Emergency Response Program. We are also joined by Lonnie Green, who is an in-center hemodialysis patient from Atlanta. Lonnie began dialysis in 1998. He's an active member on the ESRD National Patient and Family Engagement Learning and Action Network, as well as the ESRD Network 6 Patient Advisory Committee. Lonnie works for SunGuard Availability Services, which is an IT company, and he works as an operations specialist. So I want to remind everyone that as we go through these presentations and you have a question, please submit them using the chat feature through WebEx or the Q&A on the lower right of your screen. When we get to the question and answer section of this presentation, we will share the questions with everyone, with our speakers rather, and then we will make sure we get through as many questions as time allows. But first, I want to start with Gary. So Gary, why was it important for you to go back to work after your dialysis diagnosis?
Well, after I got sick, I was actually down for about a year. You know, it took about a year for me to recover, and I was actually bored to death. And then the company invited me to come and cook for them because that's another one of my passions. So I came in to cook for them, and then I actually worked for a year, and then I had to leave the company after a year. Then I left town for a while, came back, and I got involved with Voc Rehab because I didn't know what to do. I didn't know what I was able to do. You know, I was kind of lost. But by working through Voc Rehab, they were able to help me focus on my strengths, and through them I was able to actually return to the company with a plan on what I could do to help make the company grow. Okay. And that's how the company ended up taking me back.
And Lonnie, I'm going to ask you the same question. Why was it important for you to go back to work after your dialysis diagnosis?
Honestly, Jerome, I was single at the time that I ended up, as you say, crashing into dialysis. but I wanted to have a family. And as you mentioned earlier, you don't really get a lot from Social Security. And then the fact that they were also taking out the premiums for my Medicare from that, I was only getting about $785 a month. And that wasn't enough to really, subsist on for myself, much less be able to get married and have a family on. So that's the main reason why I decided to go back into the workforce.
And Lonnie, did you have to go back to school to learn a new skill in order to do the job that you currently have?
Yes, sir. At the time, I was working at Walmart overnight, and this was back in the early 90s. I was making $7 an hour unloading trucks. And, of course, that wasn't going to be much more than the Social Security. But before I took advantage of the vocational rehab, I went down to a deco. Since I worked overnight, I would get off at 7 in the morning, and I would catch the bus down to a deco, which is a outsourcing company like Manpower. And the young lady would let me sit on the computer, and I taught myself Microsoft Word and Microsoft Excel to try to, get something where I know that I could go into a field that's going to allow me to make more than the $7 an hour. And after learning those particulars, I was able to get a job utilizing both of those applications. And then from there, that's when I began to look into vocational rehab.
And Gary, same question for you. Did you have to go back to school to learn a new skill in order to do the job that you currently have?
Not in as much as that, but what voc rehab and going back to school did, I went to college. I did 2 semesters, and what it did was it really enhanced the way I look at business. And because I've been with this particular company for so long, it has allowed me to help the company make decisions that have enhanced our growth significantly and make different decisions that have really made an improvement in how we sell different products.
Okay. Gary, what, if any, challenges did you face getting back into the workforce, and how did you overcome those challenges?
Well, for me, timing was everything. How do I go to work and manage my health at the same time? I think that was the biggest thing. I know the owner of the company, he was a bit concerned about that as well, because he was well aware of my condition, being that he was there at the onset of it. But through time, I was able to get the timing down. I'm able to do my dialysis, get into work, get everything done, and everything is a real smooth transition. But it just takes time to kind of figure those things out. And I think I've done a pretty good job of that. You got to figure out how to get your dialysis done, and some days you have different appointments and stuff like that. And I've just managed to do that very well. And being open with the owner of the company has been good. He's allowed me to set my schedule. I come in to work at 7 o'clock. I'm off at 3. I can work on the weekends if I need to take time off during the week. My schedule is very flexible. But, that is because our communication is clear.
Lonnie, I'm going to ask you the same question. What, if any, challenges did you face getting back into the workforce, and how did you overcome those challenges?
Well, initially, some of the companies that I worked for, like GTE Wireless, which has hence turned into Verizon, on the days that I would have dialysis, they would actually let me go a little early. But the company that I'm working for now, which is SunGard, I've been there for 13 years. And I do in-center hemo, but I do that on Monday, Wednesday, and Friday. And so luckily my schedule allows me to work on a Thursday daytime, but I'm overnight on Friday, Saturday, and Sunday. So even though I do dialysis like Friday morning, I'll come home, I'll sleep for a couple hours, and then I'll go to work Friday night and do 10 hours. I do 12 hours on Saturday and Sunday. And it is a little strenuous sometimes to do a 12-hour shift and then get off Monday morning and go into the dialysis clinic at 10. But because I've kind of alternated the days between the days I have to work and the days that I actually do dialysis, it's been working out for me.
And Lonnie, how did you learn about vocational rehab services?
It was actually introduced to me through when I was getting Social Security. I had asked them about some of the programs that may be available to get me back to work. I sat down with the counselor there, and they briefed me on some of the things that Lisa was saying. You know, you're able to work for 9 months, make as much money as you can, and, you know, depending on what you do after that time, you do have those stipulations like she set forth on how much you can make. But it was basically through someone at Social Security through the Back to Work program.
And Gary, same question for you. How did you learn about vocational rehab services?
Mine was through Network 16, and then I talked to my social worker, and we got the ball rolling from there.
What type of support did you need to get from your family during your job search?
For myself,
For Gary? Mm-hmm.
Other than, you know, my wife is just a great partner. She has been a great partner. She'll make sure she's very good at keeping track of where I have to be. And I think with that, you know, with her being able to really keep me on track, that has made a big difference in my success so far. So I kind of to her.
Lonnie, same question to you. What type of support did you get or need from your family during your job search?
That's really a good question because I wasn't married at the time. I guess the need for having a family was enough of a drive for me to get out there and do what was necessary. So while I didn't have the family to actually be that support, the fact that I wanted the family was enough to keep me driven.
And Lonnie, what type of safety measures do you take to ensure you remain safe from COVID-19, you know, now that you have to leave the house?
You know, I take the normal measures that the CDC is setting forth when I'm out in the general public, wearing the mask. We keep hand sanitizer in the car. Definitely social distancing. When I go to like the gas stations and things like that, I take a glove to make sure, you know, that I use those when I'm using the pump. On the job, you know, I already told you about my schedule, but on Thursdays I only work with one other person. We do work with a skeleton crew. And luckily on the Friday, Saturday, and Sunday, which I do overnight, I'm actually in the building by myself. Now, we do have vendors that will come up, but at that point, we are still using the same thing with the mask, the social distancing, and the gloves.
Okay. And Gary, can you talk about the safety measures you take to ensure you remain safe from COVID-19 while on the job?
Well, my company has gone through a big transition. I know in March, you know, I had a sit down with the owner of the company and told him that with my being the most vulnerable in the company, that I would have to start working from home. And he said, okay. And so I started working from home. But about 2 weeks after I did that, we had a big order, and they really needed me to come in. And so when I returned, the entire company started at that point in time wearing masks and social distancing, and there was hand sanitizer all over the place. And there's a major effort to keep everything clean and sanitized. And I have to say that we have transitioned very well into a COVID-aware environment. We closed our showroom. Now, in order to enter the building, we do have to allow customers to enter the building every now and then, but they have to wear a mask. And if they don't want to wear a mask, they have to stay outside. So those are the measures we've taken to protect me and us from COVID.
All right. Thank you both. I want you to hang on for a bit longer. Now we want to hear from our audience. If you haven't already done so, please submit any questions you might have using the chat feature or the Q&A through WebEx. I see that we do have a few questions in the chat, so I'm going to start with one that I think is for Lisa. Lisa, what's the best way to learn about telework opportunities?
Well, I think one of the virtual employment networks that I've mentioned, back to that, specifically specializes in telework. The National Telecommunicating Institute. You can actually just Google that. The link is in the slide that I think Jerome will probably be sharing this presentation, I'm pretty sure, or it'll be recorded and posted. But they help with work-at-home jobs. Probably a lot of these employment networks, the virtual ones do, because the assumption is if you're online and you're reaching out to them and they can help you with it. I know Career One Stop also has that as part of their job search. And perhaps just reaching out to an employment network, which I would recommend over a Voc Rehab office right now. Although I hear the Voc Rehab offices are working with patients. There's a limited workforce, I think, sometimes because of the COVID-19. The employment networks, again, to search for that is actually on a Social Security website called Choose Work. So it's, if you, again, you Google Choose Work, but you'll also see this in the slides. I'd start with that with a zip code search, and it'll ask you, do you want virtual Voc Rehab employment network or all that's available in your area? And you can also pick a radius on your zip code search.
All right. So this question could be for Lisa or our two patient panelists. Who would I talk to about going back to work, my social worker or someone at the network?
So I would start with your social worker, and often the social worker will get technical assistance from the network in helping you. And then sometimes social workers will reach out to me at this network and say, can you call my patient or can you help? And I can speak for all the networks. We've all had this common interest. The networks are happy to do that, to help if it's beyond the scope of the social worker who might be new in dialysis and doesn't have a lot of familiarity with the Voc Rehab.
Thank you, Lisa. This question is for Lonnie and Gary. Being dialysis patients, how do you have the energy to work full-time jobs?
Well, for me, being on peritoneal dialysis, I feel a lot better since I have gotten off the couch, and I think that in itself has been what has given me the energy. When I didn't work, I didn't have anything to really keep me moving. And I think that just in itself has kept me going more so than anything. my days are full. I used to take a nap I used to take naps every single day. And now I don't have the time to take naps because, I have orders to get done. I have round slings to make, rope to splice. And so my days are really occupied.
And Lonnie?
Yeah, I agree with him. I think the more active you are, the more active you're able to be. There are times, that you have to make sure that you're paying attention to your resting hours. Exercise and diet also help, and that's even in the face of the COVID, since one of the main things that allows us to resist that is a good immune system. But I think a lot of times if you attempted to challenge yourself, then you can find out, what you're able to do, which I believe that's the beautiful thing about the Social Security is that in that amount of time, they're giving you 9 months, not just to make as much money as you can, but that's a trial period for you to figure out if you're able to go back to work. And with you still receiving your benefits, if for some reason you give it a shot and you're not able to do that, then you can sit back and say, okay, should I find something else that is maybe less strenuous or arduous on my body, or should I just go on and not work at that period? But I do thank them for actually giving you almost a full year for you to ascertain that, the level of your ability to work.
And to further that, I think that's where voc rehab was really good for me because it really helped me to hone in on just where my abilities were. And it was very good on getting me focused.
Yes, I think for those who don't really know what all will be encompassed with the voc rehab, they do a lot of testing. You'll go in and, you'll have little mazes to do. And what they do is they're able to ascertain your personality type as well as the job fields that they believe that your intellect gives you the ability to do. And so they will give you a whole list of things that they feel like you will be good at in the occupational area, and you're able to move on from there. And they will send you to school, even if, like with mine, they were talking about like data scientists and things of that sort, but I really didn't want to go into that particular field. So it's not that you'll be limited to those jobs that they'll list you for. You can go into the things that you have a desire for, but the testing in itself is very eye-opening.
That's very helpful. There's another question that came in. It says, do you have kids at home? What are you doing to make sure everyone is being safe when they leave the house?
My kids are well aware of what's going on in the world, and I keep them well aware. Luckily, they're old enough to where they want to be safe themselves. We've bought masks for them. They're good at hand washing, and they're just aware. And I think once again we go back to communication. We talk about what's going on all the time.
And it's basically Lonnie? The same. Yeah, it's the same for me. I got 3 rambunctious boys, 2 of them in the teens. Thank God that they're not living in the times that I came up. They do have all of these online platforms and things that they're able to keep in touch with their friends. They're able to FaceTime, Zoom, and they play on their games periodically. But we still do make sure that they're getting outside. We practice, like we said, social distancing and mask wearing, because we definitely want them to keep their vitamin D levels up and make sure that they're staying active with exercise and all. But just like Gary was saying, we sit them down and make sure that they know that at the times that we're keeping them inside, that it's not a punishment. We let them know what's going on and the things that we have to practice to be safe. So we keep them well informed as well.
And we got one other question for Lisa. What's your process in helping a patient seek voc rehab services or employment?
Okay, I'm unmuted, sorry. It depends on the individual and what their goals are. I think it's just really important to flesh out what they want to do and refer appropriately. There's a program under vocational rehab or employment networks or the virtual programs that really is going to fit everyone's needs. I think the key is having motivation and having the patients to work with them. I even had a patient one time who wanted to work for himself and have a food truck, and I helped him to kind of edit a small business plan, and so did his voc rehab counselor. So I really think the sky's the limit. If you know what you want to do, you have the capability of doing it or the willingness to learn what you need to do it, and you stick with it with your voc rehab counselor. Hope that answered the question. I don't work directly with patients, by the way. I do because I answer the phone all day long with the ESRD Network, and I help social workers help patients, and I work with my patient advisors, but I don't provide direct patient care anymore.
Okay. Well, Lisa, thank you very much. I also want to thank Gary and Lonnie. Your insight has been very awesome today. So thank you for being with us, and we really appreciate the time and advice that you've provided today.
You're welcome, John.
You're welcome.
So as we move on, we want to remind everyone about the kidneyhub.org. It's a mobile-friendly web app developed by the NCC with lots of input from our patient subject matter experts. If you haven't been on it yet, I highly recommend you try it. It has information on home dialysis, the kidney transplant process, infection prevention, mental health, and more. There's also a video on high KDPI kidneys. And we're always updating that resource with new information, so check it out and share it with your friends and family. As a reminder, our patient COVID-19 webinar events have been moved to every other week, so our next patient event is Tuesday, August 25th. We will be discussing staying safe in a multi-generational family. The next professional COVID call is next Wednesday, August 18th at 3 p.m. The topic, home dialysis in the COVID-19 era. Healthcare professionals can earn a continuing education credit for participating in that call. And thank you all again for being with us this afternoon. For additional COVID-19 resources, visit the CASER website at casercoalition.com. You can also review additional COVID-19 tools at kidneycovidinfocenter.com. Thank you, everyone. Have a good evening.
Thank you.
Thank you.
Bye-bye.